Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response in Missoula, Montana. Today is March 30th, Monday, and this is my daily briefing. So currently we are sitting at 12 cases of COVID-19 in Missoula County and 171 cases in the state. There's been 4 deaths in Montana, all in other counties, not in any, there's been no deaths in Missoula County at this time. The one big thing that's changed since the weekend is we are now starting to see signs of community spread. And what that means is that we have cases where the exposure to COVID-19 can no longer be traced to another positive case or connected to travel. You're probably wondering how we determine that we have community spread. So this is kind of the process of how that works. DPHHS contacts us and lets us know that we have a positive case. And then our nurses follow up with that patient to determine where they could have gotten sick and also to determine who they may have exposed to this illness during the time that they have been having symptoms. Our nurses ask about travel to see if they've been to areas where there's widespread COVID-19 or if they've been in contact with someone who's tested positive for COVID-19. Up until this weekend, we've been able to trace all of our cases to travel outside of Missoula County or contact with another confirmed positive case. This situation has now changed, and so the community spread means that we're likely going to start seeing more cases in Missoula, and we could potentially see a very rapid increase in the number of cases that we have here. Community spread also means that the precautions such as physical and social distancing are much more important than ever. So it's super important that you just stay home as much as possible, follow the governor's stay-at-home orders, local orders, and standards for physical distancing that are put into place by the essential businesses, such as our grocery stores. You might start seeing that there are going to be 6-foot markers on the floor so that people can make sure that they're standing that far away from each other whenever you're standing in line at the grocery store. And it's really important to stick to those precautions because the only way that we can limit the spread of this disease is to limit the number of people who are exposed. So the other thing that happened over the last couple of days is that we have now had a healthcare worker who tested positive for COVID-19 here in Missoula. The person is isolated and all close contacts have been directed to stay at home and to watch for symptoms, and they're being monitored daily by the nurses here at the health department. The affected healthcare agency is following all of the recommendations and working cooperatively with us here at the health department. So this is not an unusual thing that when we are in an outbreak situation that a healthcare worker would test positive for the disease. Healthcare workers are on the front lines, and so they have a much higher risk of exposure than even our general population. There's likely going to be more healthcare workers that become affected over the course of this outbreak. However, that does not mean that we want you to neglect your own health or fail to seek medical care when you need it. Our healthcare workers screen for symptoms at the beginning of each shift, and they follow all of the procedures that are recommended in order to minimize risk to patient care. So if you've recently been to a healthcare provider in the last few weeks, you're not having any symptoms, and you have not been contacted by the health department, you are not considered a close contact to this person, and so you do not need to be tested. If we feel that you would be a close contact to this person, the health department would contact you. The other thing that has changed is that the CDC has come out with additional recommendations on who fits into that vulnerable populations category. So we know that people older than 65, those who have underlying heart issues like high blood pressure or lung disease or asthma, or those with diabetes, are predisposed to poorer outcomes with COVID-19. However, they do not have enough data to determine how other health conditions are affected by this disease. Since other viruses can disproportionately impact pregnant women and those who are immune suppressed, such as people who are getting treatment for cancer or those taking immune suppressing drugs, and those with HIV or AIDS, the CDC has now included those additional groups into the high risk group. So again, that is pregnant women, people who are immune suppressed, such as people who are being treated for cancer, people who are taking immune suppressant drugs, and people who have HIV and AIDS. If you fall into these groups, it's important to stay home as much as possible and don't neglect your health. Reach out to your healthcare provider to see if there's options for telemedicine so that maybe you can minimize your risk of exposure if you need to seek healthcare. and be able to stay at home. If not, be sure to take those extra precautions when you are seeking care. So that's all I have for my daily briefing today. Everybody stay healthy, and thanks for everything that you are doing to help keep our communities safe. And I will talk to y'all again tomorrow.